Now I'm going to demonstrate the insertion of an IV cannula. To do this first, we're going to, if the patient's conscious, we're going to explain the procedure to them. If they're unconscious, we're going to assume that consent is implied. So the first thing I'm going to do is put the tourniquet on. So we're going to tighten that. I'm going to check if there's still a radial pulse just to make sure that I haven't occluded the arteries, that I'm only occluding the veins. I'm going to choose a vein. Once I've chosen the vein, usually go for a straight vein that's nice and plump. I'm going to use an alcohol swab. I'm going to swab the site. I'm then going to choose my cannula. I've got all my equipment set up so that I don't have to be setting anything up while I'm trying to cannulate. Sharps out. I'm going to have the bevel facing upwards. I'm going to use my thumb to anchor the vein. I'm going to go in at a 10 to 20 degree angle. Once I hear a popping sensation, I'm going to reduce the angle of the cannula. I'm going to insert just a little bit further, and then using my finger I'm going to advance it all the way up to the skin. I'm then going to clear the vein, release the tourniquet. I usually get, this has been primed already, I usually get that ready so that when if blood starts to come out, I'm not letting it spill everywhere. So sharps away, and twist it on. I just got water flashback. Usually in a patient you would obviously get blood flushing back if you've got into the vein. To secure the site, I'm going to use a tegaderm. It goes over about half the way up of the blue section there. I've got my tape as well. Now the first one I'm going to go under, and I'm going to do what's called a chevron, and it's going to go over one way and cross over the other. Then just to make sure this is more secure, I'm going to put another section of tape just across the cross there. Got another bit of tape just across where the extension tap fits onto the cannula. And the last bit to secure it is for the extension tap itself. It's a bit hard to stick it on the mannequin because it's a bit wet. Usually you go across and you tuck it just around the extension tap just so it's a bit of extra support, so that if it was to be pulled there'd be less chance that it would be removed. Once we've got it all taped, to ensure patency of the vein, we're going to flush it. So you start by ensuring that the flow is off to the valve that you're selecting. You're going to take the cap off, insert the flush, open it, open the way, and insert some water. And if there's no bubbling up of the skin and the patient reports no pain, then that's a good sign. Turn it off, take it back out, insert the cap back on. That way your water's not going to come straight back out. Woo!